All right. Sorry about that. I see people coming back in. Appreciate you all sort of sticking with this and joining back in. Having trouble getting one of our hosts access for some reason. All right, looks like we're having a little bit of issue, and it looks like Maria's here.
Awesome. Thank you guys all so much for your patience. We now luckily have all of our hosts, so we can get started. Hello, everyone. Welcome, and thank you so much for joining us for this seminar, Building a Career in Implementation Science, Experiences and Insights from Implementation Scientists Across Career Stages. This event is part of the 2024 Institute for Implementation Science Seminar Series, which features lectures from leading implementation science experts. Registration for upcoming seminars and recordings from past seminars can be found on our website, which will be linked in the chat a little bit later on. We have a few quick announcements before we get started. This seminar is being recorded and the recording will be posted on our website after the event. All microphones are going to be muted, so if you have any questions or comments during the seminar, please enter them into the Q&A box as there will be enough time for questions after the presentation. If you're interested in receiving CHESS or MCHESS continuing education credits, those will be available for attending the seminar, and details on how to receive those credits will be shared towards the end of the presentation. Without further ado, I'm going to be passing it off to our facilitator, co-director for the implementation or for the Institute for Implementation Science, Dr. Maria Fernandez.
Hi, everybody. Thanks again for your patience with our technical difficulties this morning. It's my pleasure to present our first speaker today, Dr. Young Kang. Dr. Kang is a postdoctoral fellow at the Institute for Implementation Science, and she received her PhD in rehabilitation and participation science from the program in occupational therapy at Washington University in St. Louis. And she has a Bachelor of Occupational Therapy from Yonsei University. Dr. Kang's research focuses on improving patient engagement in healthcare, disease management, and daily life as a key mechanism for enhancing health outcomes and health equity, and on translating these interventions into practice using community-engaged implementation science. So welcome, Dr. Kang, turning it over to you.
Thank you so much, Dr. Fernandez, and really nice to meet everyone here today, and thank you for the opportunity to share my work with everyone here. So today I will share my trajectory as an early career implementation scientist, lesson learned, and also future directions. I'm looking forward to meet everyone and have a chance to interact with you at the end of this presentation. So again, my name is Young. I'm postdoc here at the Institute for Implementation Science, UT Health. Today, I'm going to share a little bit about my career trajectory and then career progress, and also share 3 key lessons that I learned, and then open for the Q&A and then discussion. So first, I want to start with just introducing myself about my career trajectory as an implementation early scientist. So I did my undergrad in South Korea, where I born and grew up. So during my bachelor degree training, I was really interested in working with people who have cancer and chronic disease in general. But that was really the stage that I'm trying to figure out what do I want, which field I'll find more interesting. And then as a licensed occupational therapist, I do understand the importance of clinical work, working with a patient care partners. but I was more intrigued about the research impact. And the reason why I was intrigued about research is I wanted to make a bigger impact by me as a doing individual this work. By doing research, I can reach out to more people rather than meeting individual people in my clinic, even though that is one of the most important thing as our profession. But then with this research interest, after I have my license as an occupational therapist, I went ahead work as a clinician researcher at the university academic schools. In that setting, I was working as a clinician researchers in the intensive care unit. I was working with the physicians, nurse, and then also patients who are seriously ill. In that settings, I was working with a lot of different healthcare providers who are really interested, who really want to improve patients' outcome. But unfortunately, I see that there are a lot of research and practice gaps. Even though all the clinicians, patient, and care partners, they are really supportive in patient care, they want to provide and they want to have evidence-based intervention. It wasn't easy, and it wasn't always the case that we provide a evidence-based best practice for the patient. So at that point, I've become curious why everyone is doing their best. They do want to really provide a good care. They have expertise, they have a good intention, but this doesn't work in practice. But I didn't know why. I didn't know what the problem is. So with that mind, I decided to pursue a little bit more intensive training in research. So that's when when I came to the U.S. in St. Louis, Washington University in St. Louis to pursue my PhD. So during my PhD, I was really focusing on working with the people who have a multiple chronic disease and then providing the patient-centered care. Disease-centered metrics are really important, but as an OT, I understand the importance of personally meaningful goals and personally important tasks to improve their quality of life and life satisfaction, especially people are having this lifelong chronic disease. And then because WashU is one of the leading institutes regarding the implementation science, at that point, I got exposed to this DNI research. Okay, this is a practice and this is a science that I can learn and develop my expertise. And this is a field that I can answer my question, why there are these serious research and practice gaps. And then I learned this framework, that intervention mapping and implementation mapping, which is one of the key focus of our institute. And I was exposed to this framework and then wanted to learn more about that. So throughout my PhD, I was focusing on two main things. One, developing a patient-centered intervention for people with multiple chronic disease, but also using implementation science framework and perspective to improve the research and practice gap. And then later I wanted to pursue more advanced training in DNI. That's why I decided I pursued to get a position here with Dr. Fernandez here, and then also Dr. Vijayabala, one of our co-directors here. So I pursued my postdoc training here. So in my PhD, I was really trying to understand the DNI framework, but during the postdoc training, I wanted to really advance my expertise in implementation science, and I wanted to contribute to improve the DNI research itself. So for example, in my PhD, I was more focusing on understanding the framework, how to use the implementation mapping, how to use other framework. But during my PhD, I was really focusing on how to advance the framework and how can I contribute there, what kind of innovation can I bring to the field. And then later, I was also working with another professors in our school to improve the implementation of patient priority care in the clinical settings. So my postdoc training was really the extension of my other training under my undergrad and then PhD, but you will see that there are lecture extension from all my trainings. And then now as I start to preparing to wrap up my postdoc training, and I want to work for the more independent faculty base, I wanted to bring all other new perspective to the implementation science. So for now, I'm working on to build my expertise in behavior economics, system science, and then also bring those to the DNI field so that I can bring innovation to the field and moving the field forward. And then we'll continue work on the clinical settings to improve the research and practice gap. And I'm also working on prepare my KO1 application application to continue build my training as an implementation scientist, as an early career investigator. So that this is a really a high level overview of my training trajectory, but you will see that I was interested in the clinical field, but I see the gap in the practice, and then I'm using and then working on the implementation science field with a passion to improve the research and practice gap. So this is a really a high level overview of my trajectory as an early career implementation scientist. But next thing I want to share is a key lesson that I learned throughout my career training. So first domain I want to share is a mentorship. There are two lessons that I want to share. There are two lessons that I want to share regarding the mentorship. Is first being very intentional when you're asking your mentorship and when you're interacting your mentor. If you are a postdoc or PhD, you probably have your primary mentors. So in my case, Dr. Maria Fernandez and Vijay Bala, they are my primary mentors. But you also probably have other previous mentors that you've been interacting with. So in my case, I have my mentors through my PhD and undergrad, and I have a continued access to them, interact with them. But also don't forget other team members around you. In our institute, we have other great investigators, seniors, who are also presenters for today. So make sure that you will also take advantage of access to your great team members that you may have. And also another thing that we often forget is your peers. Throughout my PhD and postdoc, I also meet a lot of great peers, PhD and postdoc at our school. And then you will be surprised how much wisdom they will have and how different experience they have. And maybe even though your experience might be a little bit similar, they will have a different feedback, advice for you to help to guide your mentorship. And next domain that I want to share is a collaboration. If you're in the implementation science field, if you want to be in the implementation science field, you probably will have some sort of a collaboration. And this is one of the main key skills that you probably want to put in your toolbox. So when you're collaborating, maybe you will collaborate with community partners, which could include patient care partners, or schools, or the organizations, many different community partners that you can work together. And I do think that during your postdoc, it is a good stage that you try to practice or maybe strengthen your network or your collaboration. So maybe reaching out to the people who are usually not in your regular circles, reaching out to the people that you meet your conference or workshop, or many other people that you don't really work together, but you want to work in the future. And the last thing that I want to share about the collaboration is collaborating with your regular circles as well. I think postdoc is a stage that you have your mentors, but it's a stage that you prepare to have your own unique skills, and then maybe preparing to collaborate your mentors and previous mentors in the future, because you probably have some unique expertise that your mentors do not have, or different focus. And then also work with your team members and even your mentees, because it's likely your interests are overlap, but they will also bring new other innovative perspective that you may not have. So I want to share my lesson that collaboration, maybe in any field, but particularly in implementation science, that's one of the key skills that you probably want to put in your tool set as an early career investigator. And then one last domain that I want to share is expertise and innovation. So if you're postdoc like myself, or when you just finish your PhD, I was thinking that, oh my gosh, I had such a long school, I had such a long training. I'm not taking any more coursework. I'm done with the assignment. I'm not taking any more finals. But then while I'm doing postdoc, I learned that continual learning is really important. This sounds really cliche, but it's not always easy, because if you're a postdoc, you will have other competing tasks or commitment that you need to complete. So you need to be really intentional to make those time for continued learning. And I do think that this is particularly important if you want to be in the implementation science field, because even though implementation science has really a strong foundation as a field, but I do believe that there are a lot of evolving aspects that you can bring innovation to the field. But to bring those innovation, you need to continue to learn. So in my case, because I'm particularly interested in system science and behavior economics, those are areas that I plan to continue to learn and then continue to improve myself and ultimately bring those new perspective and evidence into the implementation science. So it will help me personally to improve my career development, but also contributing to the field to improve the field, but also narrowing the research and practice gap in the research gap in practice and real world. So that's a really important lesson that I learned. And I also want to wrap up this my quick presentation by sharing that the importance of really a supportive environment, especially as a postdoc. As a postdoc, you will likely have your expertise, your perspective, thoughts that how you want to navigate your research. But sometimes it could be intimidating to bring your perspective and then participate in a discussion, especially when you're interacting with your mentors, seniors, or people outside of your regular circles. So from that sense, I find myself very lucky to work in such a supportive environment here at UT Health, because I don't feel I feel really safe to bring new perspective and ask the question that I sometimes find myself silly to ask. So it is really I learned that it's very important that you find the environment that works best for you as an early career scientist, to not too afraid of ask question, even though you may find sometimes silly, or bring completely new ideas to really make a innovative new directions to the field, but also in a way to develop your own expertise as an early career scientist. So those are really key 3 lessons that I learned, but I'm also excited to learn from other presenters and also learn from the discussion session to all about you. But hopefully I find that this lesson that I learned could resonate with you or bring some new thoughts. So with that, I think I will wrap up my presentation and want to thank everyone to hearing my stories and looking forward to learn about you.
Thank you so much, Dr. Kang. And we're going to have discussion at the end of the 3 presenters. So if you have any questions right now or comments, feel free. Use the Q&A, please, for questions. Next, I'd like to introduce Dr. Serena Rodriguez. Dr. Rodriguez is a behavioral scientist focused on designing, implementing, and evaluating interventions that improve healthcare delivery and reduce disparities, particularly among historically marginalized patient subpopulations. Her research blends training and implementation science and cancer prevention and control with expertise in community-based global health work. Dr. Rodriguez has led studies examining access to women's health services in rural Uganda, cervical cancer screening among women with refugee status, and cancer care delivery for women living with HIV. In addition, she examined vaccine hesitancy and HPV vaccination uptake among under and uninsured adolescents. Prior to academia, Dr. Rodriguez worked for a social justice organization in Brooklyn, New York. Turning it over to you, Serena.
All right. So as Dr. Fernandez said, I'm Serena Rodriguez. I'm an assistant professor in the Department of Health Promotion and Behavioral Sciences here at UT Health Houston. And when I was asked to give this talk, I was thinking, what experiences or lessons learned can I give as a person in early stage of my career? I'm starting year 4 of my faculty position, and I am a card-carrying implementation scientist. But how did I get there? What did that look like? And so I really started looking at sort of my trajectory. And I hope that as I talk through what that looks like, that you can see yourself in some of these steps that I took. You can think about things in new ways. And really, I was thinking about my doctoral students and postdocs and folks who are on the job market who are thinking about a career in implementation science when I was putting this together. So I first thought, what in the world would I tell myself just out of college, 22 years old, ready to take on the world? How did I get to where I'm at right now? What are the lessons learned in the past 20 years? First, ask questions. I was a painfully shy child and can be actually a very shy person. So it took me a while to feel comfortable, both inside the classroom and outside of the classroom, really asking questions for things that I wanted to dig into and really learn more about, talking to people that I saw who were potential mentors, who had experience in the fields that I wanted to be in, to just ask questions. I know as a researcher, I love talking about the work that I do. I care very deeply about the work that I do. I'm always going to answer questions for anyone who wants to know more. So really asking questions to people, whether you see them at a conference, hear them at a talk, sending an email, as a follow-up, always a good idea. The second thing that I thought about is that there is significant value and experiences in training outside of the classroom. So we spend, as Young said, so much time in the classroom and learning, right? Books, theories, frameworks, models, all of these things, equations. There's so much also significant value in the training that we get outside of the classroom. So I'll talk about my work as a nonprofit professional. I brought all of that with me back into academia, back into the classroom, and it created a really sort of rich experience. As Young said, mentorship is critical, whether that is mentorship in your job, mentorship in your academic life. I can't speak highly enough about finding the right mentors for you. And then also that for myself, the diversity that I have in my interests and my experiences is not a flaw. It's actually a strength. And there is a through line to all of the things that I have done. There is a string that connects all of these things. So while I used to think, I went into a doctoral program with an idea of what I wanted to do, but I wasn't as specific as my peers who knew they wanted to do, breast cancer work with this very specific population or wanted to do exactly this. They were very passionate about it. Whereas I had a lot of varied interests. That's actually a strength, not a flaw like I thought all along, where I was like, why can't I make up my mind? And I'll show you what I mean as I walk through. So this is what my sort of journey over the past 20 years, like I said, has looked like. I started off at Rice University, and I was the first person in my family to attend college and graduate from college. So I was persistent in wanting to get experience that was outside of the small town in Texas that I had grown up in. It was a town of about 7,000 people, and I wanted to see the world. What that looked like for me was that in college, I did a service learning trip to Haiti. And I spent 2 weeks working in or the Haiti earthquake of 2010. And Haiti is a beautiful country, but we know that it has some very unstable wanted to do some sort of service delivery. I was very interested in international health, international development. So that led to my formal training, Master's of Arts in International Development. And it was a service learning degree where I spent half of my week in an organization volunteering, the other half of my week in classes. And actually half of my program was in Jamaica and half of my program I wrapped up in London. So I was doing this very formal international development, touring international NGOs on service learning trips, doing on the ground work in the communities that I was living in. But what I learned outside of the classroom goes along with implementation science. Now that I've taken a look and kind of surveyed, what I've done, I've been doing and thinking about implementing programs since all the way back, in 2004. So when I was working at these two organizations, one being Mustard Seed Communities in Jamaica and the other, the Royal Marsden Cancer Hospital in London, was thinking about program delivery and resource settings, was learning about the capacity of local nonprofit organizations in Jamaica and getting a glimpse into fundraising and what it takes to run a business of hospital systems when I was working in London. I was on the fundraising team, doing everything from, sorting the mail to running errands to data entry when I was at the cancer hospital. And what I realized after that was I needed more training or wanted more training in sort of public health. So I applied to and got into UT Health Houston School of Public Health, where I got my MPH in health promotion with a focus again in global health. And there I was introduced to and learned intervention mapping. My primary mentor was Kay Bartholomew, who really taught me the value right off the bat of what it means to have a mentor who is very much in your corner and wants to help you build your CV. While I was doing my MPH, I was able to do my practicum at the Population Council, which was an international NGO, and I was actually based in Nairobi, Kenya. I got a travel scholarship through the university to do that internship. And so that was really my first introduction to research, because I was helping a senior researcher do some literature reviews, data synthesis. We actually went out to a rural community and did some data collection. So I'm starting to get my feet wet with research while also still thinking about what does it look like to deliver programs in a low resource setting? And actually, what is the capacity of this large international organization? What is the business of this? What does it look like? And still kind of thinking along those lines. After my MPH, I was ready to go out into the field, put my knowledge to use, and I moved to New York City. I was one of those people who literally moved with friends to New York City without a job. And because I had this introduction to fundraising when I was working at the Royal Marsden, I was able to actually get a job in development and fundraising. And as a shy person, I was thrust into this world of events management, where I was working with corporate partners, large artists for different events that we were throwing, and really built my confidence in a lot of ways through that position. So I was doing fundraising, development, introduced to grant writing, budgeting, and attention to detail, which comes in very handy as a professor, thinking about grants, doing events management, attention to detail. And then I worked at a nonprofit called Groundwork, and we were delivering educational programs and social services in East New York, Brooklyn. It's a social justice focused organization that really focuses on supporting the whole family to support the children to get through and to college, to and through college. And again, I'm writing grants, I'm helping support development and fundraising, and I'm looking at the business side of a national nonprofit and education system institution at ICP, and then of a local nonprofit organization when I was working at Groundwork. And at Groundwork, we worked in a three-story walk-up in the middle of East New York, Brooklyn. And so we're all very close. My office was basically the living room with 4 other people. And so I sat right next to the person who was doing our evaluation. And we had a very robust program evaluation component to all of the work that we did. And I was very interested in not only how we're delivering the services, but also how we're evaluating those. And it kind of clicked back in that training that I got when I was at UT Health and at Roehampton. And ultimately led me to wanting to go back to realizing I was interested in evaluation and was interested in research. And I applied to doctoral programs and ended up going back to UT Health Houston School of Public Health for my PhD in behavioral sciences. I never not worked when I was a PhD student. I was a graduate research assistant on multiple projects, including one for Dr. Fernandez. And while I'm in the classroom learning biostats, how to put together a manual of operating procedures, I'm learning additional theories, doing all of that formal training. There's the informal training through learning how to manage a research project, how to be a project coordinator, how to support staff and data collectors, doing hands-on program development and implementation, thinking about how do we enhance the adoption and implementation of the HPV vaccine, which was the focus of our research project and eventually the focus of my dissertation. Getting my feet wet with grant development and grant writing as a doctoral student. And then also I was a TA, so learning how to teach. All of this sort of informal training that I had in addition to being in the classroom. After my PhD, I did a postdoc in cancer prevention and control and formally in implementation science. I realized that all along I had been thinking about not just how to develop programs, but how do we implement them again in these resource limited or low resource settings. So I wanted sort of some formal training in implementation science. I knew intervention mapping and co-authored the implementation mapping manuscript, which is how do we systematically think about and develop and implement and evaluate implementation strategies. So I worked with Dr. Fernandez and our colleagues in the Netherlands on that manuscript. And I was also a scholar for at the Institute for Implementation Science Scholars, which was at Washington University in St. Louis. It was an R25 program, and I don't know if it still exists or if it was renewed, but I really got my formal training there in implementation science theories, models, and frameworks, methods, and study design. So it helped pull together all the things that I had already been doing, but put them under an umbrella and let me give them names. During my postdoc, I also did, again, grant development, grant writing, how to build partnership, do some collaboration, as Young was talking about. And I was working in particular in an integrated safety net healthcare system, where I was bringing together my global health background and my cancer prevention background. And so I was doing cancer prevention among refugees at Parkland, which is our integrated safety net healthcare system. So learning again about data collection. And then also another really important thing to me is work-life balance. So what does that look like in figuring out how to do all the things that I really enjoy doing, but also do it in a way that I don't get burnt out, which I think is very important. Ultimately went on the job market, and now, as stated, I'm an assistant professor here at the Department of Health Promotion Behavioral Sciences. And all of this work has culminated in two primary research focuses that I have, which are enhancing refugee health services within an integrated safety net healthcare system. And I also do substance use prevention, treatment, and recovery support services work. And you can look at our Project Homes for more information on that. But I'm also a methodologist. I'm taking all of the work that I've done, all of the lessons I've learned, and I support other folks in developing grants, teaching how to use implementation mapping to develop implementation strategies. How do we select implementation science theories, methods, and frameworks? How do we evaluate implementation science outcomes? And the whole path has kind of led me to these sort of places that I'm at right now. And it doesn't, I think originally it felt to me like, oh, well, I'm doing some of this, I'm doing some of this, I'm doing some of that. But really the through line for me has always been, what does program delivery look like in these low resource settings? How can we support communities? And how can we ensure that what we're doing in these communities is sustainable? And all along, I didn't realize I was doing implementation science, but I was, and that is what I do today. I have my contact information here. That's a QR code to my bio and my CV if you want to take a look at that. And again, ask questions, reach out if you're interested. Always happy to chat. If you see something on there that you're interested in, definitely let's chat. And I will pass it off.
Thank you so much, Dr. Rodriguez. Okay, now we're going to our senior faculty person, Dr. Samiran Ghosh. Dr. Ghosh is a tenured professor and vice chair of the Department of Biostatistics and Data Science at University of Texas School of Public Health, and that's at UT Health Science Center at Houston. And he's also one of our core faculty at the UT Health Houston Institute for Implementation Science. He's also part of the Coordinating Center for Clinical Trials. Before joining UT Health Houston, he was the Charles H. Gershenson Distinguished Faculty Fellow of Wayne State University for more than 10 years. His current methodological research is focused on developing statistical methods targeted primarily for precision and personalized medicine through intervention and clinical trials. Some of the areas include non-inferiority, cluster randomized, stepped wedge, MOSE, SMART, JEDI, N of 1, and Bayesian adaptive trials. He's specifically interested in the topics of mental health, cardiovascular disease, and behavioral health interventions. These are a few areas that he has considerable knowledge domain, but primarily a methodologist. Turning it over to you, Dr. Ghosh.
Thank you. So let me share my screen. Okay. Thank you, Maria, and thank you, the first two speaker. Again, I'm a professor and vice chair of the Department of Biostatistics. These are the affiliations that I should describe. So again, before I begin my talk, my talk probably will have a little bit more research focus. Just a disclaimer, this is the view of a statistician with significant experience in randomized controlled trial. So there is some bias because all studies don't have to be a trial. Even with the statistical community, the views, for example, I'm going to express are not unique. So there is considerable variation that we should expect. My views do evolve over time with new experience. So, there is always a concept of reliability. And so please be curious, and we should always ensure that, whatever we are trying to describe is valid. So these are the 4 key words, I think, that is important for any studies. So my background, I think Maria explained a little bit, but I'll tell slightly more details. So I joined UT School of Public Health in 2022. This is, in fact, my first job in the School of Public Health. Before that, I was faculty at the School of Medicine, both at Wayne State and Weill Cornell Medical College for more than 12 plus years. I founded and directed Biostatistics and Epidemiology Research Design Core at the Wayne State University for 5 plus years. Lead different grants, for example, P30 and P50 Center grants, Data Science Core. Here we got funded after coming here to Institute of Implementation Science, 3 grants. I will talk about U54, EO1, and a contract through MSIN, Multiple Sclerosis Network. I've written many grants, so there is a heavy bias of my presentation, for example, that what I learned from those grants. I'm a standing reviewer of an NIMH study section since 2021. I am also a reviewer of CDRMP, DOD, and PCORI. I have mentored experience at different stages. For example, I have mentored 4 postdoctoral trainees in biostatistics. I have also mentored other trainees through the K Awards. So my transition story, again, when I started my career in 2006, after finishing my PhD in statistics, not in biostatistics, in statistics. So it was primarily focused on clinical trial. And when I say clinical trial, primarily phase 2, phase 3, efficacy seeking clinical trial that can be done through standard mechanism or through cluster randomized trial. Now, I would like to takes a note from one of my colleagues, Dr. Anand Naik at UT School of Public Health in 2009. He wrote a paper in New England Journal of Medicine, and in fact, in 2009, with a new funding of $1.1 billion from the Obama administration, there was renewed interest for comparative effectiveness research, which is you will see there's 3 continuum, efficacy to effectiveness to implementation. So effective research was very much emphasized. I think it was there, but that this funding mechanism, when it came in, it was further re-emphasized. In 2015-2018, I received a contract from PCORI, developing Bayesian methods for non-inferiority trial in comparative effectiveness research, which kind of spearheaded my focus from efficacy to effectiveness research. That mechanism resulted in 10 plus papers. 7 of them are biostatistical methods papers, all targeting comparative effectiveness research. Now, in 2017, one of my longtime collaborators asked me if I will be interested in implementation trial. Before that, I knew the word, but I never put attention, what is different in implementation trial that is not there in efficacy or effectiveness trial. So essentially, then 2018, we got actually funded National Implementation of FOIC and SIMPAC in the Bahamas, implemented strategies and improved outcome for HIV prevention. So this is again another kind of stopgap. So another point where my research got diverted from efficacy to effectiveness to implementation science. So along the same time, hybrid design came into my attention. It's not that hybrid design started in 2018. It has a longer history than that. But I put my radar into that, okay, there is something called hybrid design, which could be used for implementation science. And then from what I have seen before 2015, I was an ad hoc reviewer for NIH for many years. And what I have seen as the time progresses in my study section, which is not specific to implementation science research, 30 to 40% of the proposal that we review has some element of implementation science. Some are full-blown implementation science research. Some may have one or two aims for implementation science. But in my experience, as the time is progressing, 30 to 40% of proposals that I review or many other people review have some elements of implementation science. Albeit many issues were unsolved as we are deciphering different aspects of implementation science, and we are still looking for asking questions. I will go a little bit of where implementation science comes into the picture. So this is taken from NIH in their different stages of research. As you can see, as we go from bench to bed science to the public health, there's a different steps: efficacy, effectiveness, implementation, and then dissemination. And as we go from bench to bedside to public health, things become less idealistic and more pragmatic. Okay, so again, I haven't defined the term what is idealistic, what is pragmatic. I'll do so in next few slides. However, I should mention that though these things are presented in steps, hardly anything is in steps, but they are more like a continuum. Okay, so it's not that we have to do first efficacy, then effectiveness, and then DNI. We can actually do things together, so that's why the hybrid design come into the question. So, but the question is that, why we need dissemination implementation studies? Because, the general rhetoric is that any intervention that is very good, like, in laboratory setup, shouldn't be readily acceptable to the public. Isn't the adoption for efficacy information is automatic? The answer is no, it is not. In fact, I have three famous quotation from three journal article. It takes 17 years to turn 14% of original research finding to the benefit of practice patient care. It came 2003, so it's like the older study at this point of time. The average of health research to result in an impact on health intervention was 14 years. It's published in 2011. And then two-thirds of the organization's effort to implementation change actually result in fail. It's in 2009. So dissemination implementation is a growing research field that seeks to improve how evidence-based intervention, or EBI that we say, are successfully adopted, implemented, and maintained in healthcare and community setup. So what are the issues in implementation science? Now, again, I'll primarily focus on statistical ones, but they are intermingled with other issues. For example, what kind of study you should take? Should it be randomized control trial, or should it be observational studies, or it should be survey research? Now, randomized control trial, or RCTs, are primarily typically clustered RCT that we do in information science. So they are not standard RCT. And whenever you bring clustered RCT, there is a slightly more involved process, like, how do you implement, how do you evaluate? Should you adjust for multiplicity? Because you see, like, when we talk about hybrid design, there is a bidirectional focus on effectiveness and implementation. So whether you should adjust for multiplicity. For example, then other question is like, what are your primary outcome or primary endpoints? Because when you do hybrid design, your outcomes for effectiveness and implementation may be different, and they may be evaluated at different point of time at different level. The other thing is, for example, repeated measure versus cross-sectional sampling. So in repeated measure, you have the ability to measure an object multiple times. I'm taking object because it could be subject, it could be some other system level entity. And then randomization, it has many issues. For example, which level you randomize, and then the price you should pay in terms of bias and in terms of evaluation. The other big question that I've faced is heterogeneity of treatment effect. For example, you may have HTE at multiple levels. Typically, when you see HTE, we talk about HTE at the subject level. But since typical implementation science studies are at multiple level studies, HTE can come from multiple levels. And then Bayesian and real world data and real world evidence should be used, and then how it should be used. Now, I'll go a little bit about hybrid studies. For example, that is a kind of a key word of implementation science studies. So essentially, we use it to improve research translation that we cannot afford to wait. Typically, it is done because it saves time, and you can do multiple things in a single study. We can continue to build effectiveness data while test for implementation strategy. There is a very interesting paper by 2012 by Quran, and then also subsequent paper that came up from Quran and Dr. Fernandez's group, which we can study. Now, effectiveness versus implementation. So as I will take a little bit more here, like, how they differentiate like 3 different kinds of hybrid studies. They typically differ in the focus. In type 1 hybrid trial, our main goal is EBI, not so much an implementation study. In type 2, there's a dual goal. You want to test both the effectiveness and intervention. And in type 3, our main focus is essentially to test the intervention, not so much on the effectiveness, because it's already established. So now this is the Institute of Implementation Science. I will skip this slide, but essentially we have 3 core, and I'm part of the institute. We have administrative core, research core, and practice core. And then we should remember, like, hybrid study is not for everything. Like, it is not like every study don't have to be a hybrid study. In fact, there is a nice schematic, that is available through institute, like, where you can see where your study fall in terms of hybrid study and whether it will be a hybrid study or not. So there are different limitations. For example, when you do hybrid study, it's a complexity, there's a cost, there's the measurement issues, and also different types of design that you should do. Yeah. So there I could talk a little bit more about the design issues. For example, typical implementation trials are cluster randomized trial, whether we should use a step-to design and what kind of step-to design, for example, albeit sample size calculations are a little bit involved. There is also something called staircase design, which is a variation of step-to design. There are also dual randomization, for example, and then multiple testing. I'll skip this slide because this is much more involved or different kinds of design, but I'll go to the last slide. So we should remember, like, behavioral or the system level interventions are unique. They're not like a drug trial, typical drug trial. High frequency AIM health or e-health trials are increasing. Adaptive designs are becoming more popular. One size may not fit all in many studies. And as a result, implementation may be the biggest challenge. The last thing I should mention that, we should collaborate, ask questions, and we all have to learn together as the field is evolving. Thank you.
Thank you so much, Dr. Ghosh. So I don't believe that we have any questions in the questions and answer section. So if any of you want to add any questions there in the few minutes we have left, or just take yourself off of mute, I think you're able to do that. One of the things, just while you're getting your thoughts together, if you have any questions that I wanted to make an observation about, is that, the 3 folks that you heard about today, they kind of came in with different expertise, different topic areas of interest. And, but I would say that all of them sort of have in common an emphasis on methods and methodologies, right? And I think that has sort of enabled them to move across different topic areas, and so that's something I think that across the stages in the career you've seen is similar across these 3 speakers today. I wanted to point out that that's not always the case, right? Sometimes people come into implementation science with a very specific focus, and they stay in that focus, right? They may not have started out as implementation scientists, but they become interested in thinking about, how do you go further along the translation continuum in that specific topic area of interest. We have a question here for Dr. Ghosh. What are your thoughts on the methodological challenges in dual randomized trials? It's a pretty complex question. Let's see if you can answer it in 2 minutes, Dr. Ghosh.
Sure. So when you have a dual aim, for example, effectiveness versus implementation, typically, because dual randomization came very recently, typically it's like a one-stop shop. You have a single randomization, and then you decide like how to evaluate them. That kind of like lower the priority of one versus the other, because you cannot do randomization focusing on both of them. So when you do a randomization, the evaluation process becomes more tricky. And so far, for example, I have seen only one paper that talked about dual randomization, which is the seminal paper that came in. There are multiple issues on how to analyze those kind of data, which is not solved yet. There is one person in our group like who actually worked on the paper, and I asked many questions to him. He told me that he has to still decipher those questions. So it's a brand new topic, and many things need to be teased apart.
Thank you. I'd like to just take the last few seconds here to thank the panelists. I know all of them personally, and I can say that they're superstars, all in different areas and different stages of their career. And I think that one of the takeaways, certainly from the more junior folks, is the importance of a collaborative environment and mentorship. And one of the things that I think Young said in her talk was the importance of collaborating with your peers, even your early stage peers. So I think that that's a big lesson learned. So thank you, everybody, for joining. Again, sorry for the delay at the beginning. And if you have any questions for any of the panelists that you'd like to follow up with, please just let us know. We'd be happy to get back with you. Have a great week, everyone.